Well, very great pleasure to be here. My name is Ruth Allen. I'm the Chief Executive of the British Association of Social Workers, and I've been involved in Think Ahead since very, very early on, not quite as early as Norman, but it's a great privilege to be here and to see it taking shape so well in all of these ways, and to hearing about what's going to happen next as well. So it's all very exciting. I'm going to be talking with two colleagues here from Durham, and I'm going to ask them just to briefly introduce themselves so they can give you a bit of context about who they are and what they do. I'm going to ask them, I've got two questions I'm allowed to ask them, and then you're allowed to get at them. So let's start by asking them to introduce themselves briefly.
I'm Tracy Joisce. I'm a strategic manager in Durham County Council, which sounds very important but isn't really. I manage a number of complex services, and mental health is one of those very important complex services that I manage.
And I'm Simon Owens. I'm a consultant social worker, so I've obviously been working alongside the unit in Durham County Council last year and this year, coming into the second year.
So I know from speaking to you briefly outside that Think has had a big impact for you, and you've had two cohorts, I believe. So I'm going to ask you, Simon, what's been your experience of working with the 4 Think Ahead participants in your first unit?
Given this a lot of thought, and I have a lot of different answers, and I know I can't give you them all, but I think for me it feels like how mental health social work should be, and reflecting on what Jack actually said before, how he said it's a privilege to work with the service users, which is how I've always felt as a social worker. It's now actually a privilege to work with these young dynamic people who are coming through into mental health social work, and how they're thinking different and how we can think different as an organisation and as social workers, because we are putting that social perspective back into mental health, which I always felt was missing as a practicing social worker. So yeah, that's definitely one of the biggest points for me, I think.
Well, that's very encouraging. Excellent. So Tracy, what's been the impact on your service of partnering with Think Ahead? I guess you see it from the wider service point of view.
Yeah. One of the problems we had in Durham was recruitment within mental health services, and I was struggling to get any students to want to come and work within mental health. I was also struggling with the calibre of social workers that were in mental health, and because we are integrated services, we are services that are a joint NHS and local authority partnership, we were really struggling to hear the social work voice in amongst those services. We had done huge amounts of training within those services around the Care Act and trying to refocus that service on being very outcome focused, but something still wasn't quite right. And so I partnered with Think Ahead, and I really pushed hard to partner with somebody who had very, very similar views and some positive contribution towards that. And it's really been successful in terms of changing the focus in that service. The NHS partners were very keen to be part of that, and they've been instrumental in supporting us with that. But in reality, I couldn't get people to come and work in mental health, and we were just saying on the way down on the train that actually not only are students want to come as part of the Think Ahead project, they're actually the students of the broader local university population also want to now work within mental health services. So that's definitely had a massive positive impact for us, and we're really pleased with that. That's really had, it's paid us dividends, putting all that effort and support in at the front end, and then obviously continuing now to encourage other social workers and other professionals within the service to be much more outcome focused in their approaches.
That's fantastic to hear that sort of motivation across the system, really. New people coming in, other students from other contexts, and changes in your organisation and in your integrated services. So it's fantastic. So now we've got an opportunity for anybody in the audience to ask you some questions. I think there should be some roving mics and things like that. Yes, there are roving mics. Excellent. So, who would like to ask a question for our colleagues from Durham? Yes.
Thanks. My question is, have you seen a change over recent years in the sort of prevalence and incidence of mental health, and how's the demand on services changing, and how should sort of mental health services deal with the changes in demand?
Yeah, Durham's, for anybody who doesn't know, County Durham has high levels of deprivation. So despite it having a very affluent city centre, that's not the norm for the whole county. It's a massive county. So we have very, very high levels of deprivation, and higher levels than perhaps the rest of the country in terms of other disabilities and illnesses. So we have had an increase, without a doubt, in mental health services, both in terms of suicide rates and referrals. We've actually invested additional professionals within the service, so it's not one of the services, despite austerity and despite all the work that local authorities and NHS bodies are having to do to try and work with that. We were very clear that it was one of the areas where we needed investment, and there hadn't been sufficient investment across the whole gambit of services, and our NHS colleagues in the CCG absolutely agree with that stance. So it's not one of the areas we've stripped anything out of. We've added to, and Think Ahead was part of that adding to, and we were keen to put additional resources into that to make it work. So that's how we've coped with that additional demand.
Great. Another question. Over there.
Thanks. Simon, I was really interested in what you said about how Think Ahead just seemed to kind of have it right in terms of social workers, and they did it differently. I just wondered what that difference was, and if you could sort of explain that.
It feels like we're developing a new breed of social worker, if I can say that. I think myself, I came out of a degree programme, and I felt quite frustrated when I come into practice because it wasn't what I felt it should be, and probably didn't have the support that I needed. But you know, the passion that I had, because I always wanted to come into mental health, it kept me going, it kept me driven. But what I see different with the Think Ahead programme is that we're investing that time up front for people to be really analytical and to really have time to spend quality time with our service users, to really understand the needs, to really understand what it is about them, what makes them tick, what do they want, very person-centred. And I didn't feel like I had that in my first year in practice, and I see that with the participants who I'm working alongside, that there are definitely this new breed of social worker. They have this passion, they have this ability to want to apply interventions, and I think for me that's really important, that we're connecting with people, we're connecting with those service users who are so isolated and disconnected from their own communities. We're helping them to get reconnected, and for me that's got to be a positive.
Tracy was saying it was also affecting the offer to students from other routes as well, so we're able to raise the standards of some of what you're offering to students from other routes, and some sort of sharing of ambition and talent across with other students from other courses.
We are. What I was really keen was, what I didn't want was a two-tier system for social workers who wanted to come into mental health services, so that participants who got the opportunity through Think Ahead got a much better experience than those students who came through from other universities. So we've tried to join that up together through our staff development programmes, and through Simon and through the mental health services themselves, so that you get that crossover of learning. And Simon's and our staff development service, who've been highly supportive, are trying to work towards how we support all students equitably in that first year of learning and onwards, and that's consistent.
It's raising standards overall.
Yeah, it is.
Excellent.
I was just going to say, could I add to that actually, because I think that is quite important, that we are actually starting to bring the social interventions into the practice as well with our other social workers, and that's definitely been a focus from working and partnering with Think Ahead.
Excellent. There's a question there. It's David.
Oh, can I go first? Ladies before gentlemen. Lynn Romero, Chief Social Worker for Adults. And
sorry,
one of the things, can you hear me?
Hello, Lynn. Yes,
Yes,
I can see you now as well. Sorry.
One of the things we were really aspirational about at the beginning of this was how could this programme and the students and the people who graduated really influence mental health services overall to, rebalance on people as people and all the social determinants of mental well-being and the issues around mental health and what causes it. So I was really impressed with what you were saying, Tracy, about the way in which that seems to be infecting, for want of a better medical word that I can think of, the whole system and the whole approach to mental health services. So I'm keen to understand what specifically is it that, for students or for graduates are able to do to influence a shift in the whole system in the way that you described?
I would say it's not just the 4 students, it's around leadership as well. So what we've tried to do is work with the team managers and the senior officers within those services, not just those participants. That would be a mighty weight on 4 participants' shoulder to change a whole service, given the size of the county that I work in and the size of it and the population of it. 4 individuals weren't going to do that. They were part of a whole systems change, and we obviously worked to try and support those students through doing training with their managers and leaders so that they were supported, so that it wasn't just about Simon. And I think that's what's made the fundamental changes, that we'd all signed up to make that difference.
Great. Perhaps time for one more? I'm looking at Ivan. We've got time for one more question. Has everybody gone shy? Oh, no, there's one there. Hello, Claire. Yeah. Just with you.
Thanks. I was really interested to hear you both talk about the impact it was having on sort of wider integration with other services. And so I was particularly interested to know the extent to which there is sort of an impact from the work that Think Ahead is doing on, if you like, the sort of the wider family services, given the fact that, many of these individuals you're talking about are going to be part of wider family networks, and also whether you feel there's any lessons to be learned yet for children's mental health social work.
It's a tricky one. So the impact that our participants are having on other services, is this what you mean?
Yeah, particularly sort of more family-related services, rather than just thinking about the individual as an individual.
Well, one of the interventions that our participants learn about is family group conferencing, which has come from children's social work. I think initially there was a collective feeling amongst participants that was quite difficult in mental health, but my personal feeling on that was actually it wasn't, because we do work with families who are complex systems. People who have mental health difficulties are part of a family or a network. So the participants in my unit were very focused on working with the families and looking at bringing those families within care planning and assessment. But actually on a broader scale, looking at the wider systems, they were also looking at those other professionals as well and bringing the professionals in. So children's services, housing, all the other services that could be possible to be involved in someone with mental health difficulties. As part of the participants' progression, they also work within the children's service as part of their contrasting placement. So what they were also able to do is to take their experiences from mental health into children's services. And actually the practitioners, the social workers in those teams have been so keen to have them back that they've actually knocked my door down this year around to have more participants to come in to learn more about mental health, to learn more about our interventions as well. So I think, yes, the answer is they are having a wider impact on other services.
I think it also helps I manage some of the children's services, so I've got that strategic oversight over both, which does affect that relationship. It's not them and us, because that's me as well. So, that has helped.
Well, thank you very much to Simon and Tracy for sharing those really inspiring experiences, and a the way Think Ahead is impacting on quality actually across your services and giving you lots of new ideas that have been really, really well shared with other bits of the system. So thank you very much.